Britain let down its citizens by leaving the nation ill-prepared for the COVID-19 pandemic. That's what a public inquiry concluded in a scathing report on Thursday. Former Judge Heather Hallett served as the inquiry chair.
I have no hesitation in concluding that the processes, planning and policy of the civil contingency structures across the United Kingdom failed the citizens of all four nations.
Former Prime Minister Boris Johnson ordered an inquiry in May 2021. Its first report was damning, saying had preparation been better, the financial and human cost might have been less. Britain recorded more than 230,000 deaths by December 2023, a similar death rate to the US and Italy, but higher than elsewhere in Western Europe.
In 2019, it was widely believed in the United Kingdom and abroad that the UK was not only properly prepared, but was one of the best prepared countries in the world to respond to a pandemic. This belief was dangerously mistaken.
Meanwhile, the nation's finances are still suffering. Hallett's report found there was a lack of adequate leadership, with groupthink clouding expert advice. A flawed and outdated strategy from 2011 underpinned the nation's preparations for such an emergency, but that had only set out to prepare for one type of pandemic, influenza. It also failed to consider the economic and social impact, according to the report. The strategy was virtually abandoned on its first encounter with COVID. Hallett made 10 recommendations, saying preparation for a civil emergency should be treated the same way as a threat from a hostile state.
Unless the lessons are learned and fundamental change is implemented, the human and financial cost and sacrifice of the COVID-19 pandemic will have been in vain.
The campaign group COVID-19 Bereaved Families for Justice UK welcomed Hallett's recommendations, but said she had not gone far enough in addressing the issue of health inequalities that had made the UK more vulnerable.